Good evening, viewers. My name is Dr. Jessica Muthe of Elim Guidance and Psychological Services Center. Today I'll be talking about understanding dyslexia among teens. Maybe I begin by defining what dyslexia is. It is a type of learning disability, and it is not a disease, but a condition. A person is born with it. People with dyslexia are not actually stupid or lazy, as it may be assumed. Many of them have average or above average intelligence, and they work very hard to overcome their reading problems. Dyslexia is a type of a specific learning disability. There are other types of learning disabilities, some of which are dyscalculia, that is mathematical computation of problems, dysgraphia, that has to do with writing problems, dystographia, that has to do with spelling problems, dysphagia, that is to do with also motor problems. Of course, my interest today is dyslexia. It's not about those others that I've mentioned. Now, dyslexia occurs worldwide, regardless of culture, language, and it affects around 9 to 12% of the world population. That has been documented by researchers. They also say that 2 to 4% of the population can be seriously affected. That means the 2 to 4% of the people that have dyslexia can be severely or significantly affected. Other researchers say that dyslexia affects 20% of the population, and it also represents 80 to 90% of those with learning disabilities, the categories that I mentioned earlier. It is the most common of the neurocognitive disorders that we have. Now, some people may want to know what causes dyslexia. Researchers have not actually given us, or they have not documented the real causes, but we have potential risk factors that may lead to dyslexia, or that may lead to dyslexia. Some of them include a family history of dyslexia or other learning disabilities. Dyslexia is said to run in families. That means if parents have dyslexia, or grandparents, there is likelihood in their lineage to have children who have dyslexia. Another risk factor that has been also documented is premature birth or low birth weight can also contribute to development of dyslexia. Another one is exposure during pregnancy to a few things like nicotine, drugs, alcohol, or even infection that may also alter the brain development of the child. Number 4, individual differences in the part of the brain that enables reading can also be a cause or can also be a risk factor that may lead to a person getting or becoming dyslexic. Now, what are some of the signs of dyslexia among teenagers and adults? It will be important for me to say, before I move to the actual observations that we could make on children who appear dyslexic, to also say that coping with dyslexia at this time of age, that is a teen's age, can be tedious. Children or teens can be subjected to ridicule and also punishment for inadequate performance in school. In fact, these are children with a lot of trouble in regular schools or in mainstreams because of their inability to perform in the class. It is also at this time when they develop behavior problems because they feel very misunderstood and very mishandled by significant others like teachers and parents. Sometimes they are labeled lazy and cooperative by some teachers. So a bit of bad language is used on them, and it's not very interesting as far as they are concerned. Now, what are some of the actual observations or signs or indicators that the teachers and the parent could look out for when the teen is having dyslexia? One of them is the speed of reading is normally slower than others in the same class. The other one is they may have additional of ones when reading. They may insert some ones and sometimes also remove some ones from the phrases or from the sentences or paragraphs that they are reading. The other one is they can have very messy handwriting with many spelling mistakes. In fact, this can be very worrying to teachers, especially when the child looks like they are not able to write, a grammatical, a grammatical statement. So they confuse us. These children confuse similar sounds, words, and letters as they read. They have difficulties in remembering names, even those of their teachers, sometimes even of their classmates, in remembering places, telephone numbers of their parents and other friends, and the dates of the month, dates of the week, months in a year, and sometimes it is very difficult for them to tell time, especially from an analog clock. They have difficulties in solving mathematical problems correctly. They have inability to complete tests and also tasks in time. Sometimes they also take more time to respond to the questions, even when the teacher has actually given them a task. They have low self-image and they like staying invisible in class. And unless the teacher is really very interested with them and prompts them to answer questions, in most cases, some of them want to stay invisible in class because they don't want to answer questions wrongly and probably attract a lot of laughter from their peers and a lot of ridicule sometimes from teachers. Now, as the child progresses in learning, it is important to note that concepts become very complex, and this may lead to a lot of frustrations, depression, aggression, and sometimes misbehavior. Remember, they are in the teenage age also. Now, how do we help a child with dyslexia, especially as a caregiver or as a parent? How would you help, or as a guardian, how would you help this child? Now, parents and the caregivers play an important role in helping dyslexic children. The child might not comprehend what is happening to them, especially because of the failures in school and tasks and assignments given given by teachers. I do know children value teachers. Teachers are very, very significant in the life of learners. So children have many questions that they are not able to ask. Millions of questions. Why am I failing in school? And this can lead them to a lot of depression, stress, and even anxiety. In fact, some of them have ended up having serious mental illnesses because they feel very misunderstood at the school level and at home. Now, it is necessary to support these children. As a parent, how would you do it? I have a few suggestions that I am making here for parents. One, you need to be patient and listen to their feelings and difficulties as a parent or as a caregiver or as a guardian. You need to make them feel comfortable to open up and talk about their feelings. Sometimes it can be feelings of failure, and they need to be discussed with a parent or a significant other person who is caring. If they show anger and frustration, it is important as a parent that you understand them and show them compassion and empathy. In other words, empathize with them, because they are going through a series of emotions that are not good. Never use the word lazy, incompetent, and dumb, as it can cause severe damage on their self-esteem. It may appear like they are doing very poorly and you are very discouraged as a parent, and the child is not able to perform academically. But it's important to avoid some derogatory terms on the child, as that would put them down and give them very serious low self-esteem. The other thing you need to do as a parent is help your child sound words and also read with them at home. Create time. Read with them. Be their friend. And the other one is appreciate and reward small achievements which they can make. They may not make very big, they may not do very, they may not achieve majorly in academics or especially in reading, but it is important that you reward and also appreciate the efforts that they make. Something else that I would want to suggest to the caregivers is that you set simple and realistic goals that can be summed up to bigger goals later with the child. The other thing is, I would like also to maybe give something small to the teachers, because teachers stay with the child majority of the day, really. They leave in the morning and they come at 5 and sometimes at 4 o'clock or 5 o'clock, meaning they have been with the teacher a lot of the time. So, to teachers, what are some of the few techniques to any teacher that you could use really to help this child who is dyslexic or this teenager who is dyslexic? One, as a teacher, you give simple instructions. Do not give multiple instructions, as they cannot cope with multiple instructions. Give few assignments and give them less work until they pick up their reading and writing places like other in the class or like others in the class. The other thing is that I would like to actually tell the teachers is repeat your instructions. Be sure that they have understood what you have just said. So you repeat the instructions. Something else is you practice reading aloud with them. Allow the learner to read a paragraph aloud and correct them where necessary. And correct them also gently. These are very sensitive children, especially in as far as academics or academic achievement is concerned. So any little mistake they make and you point at it very in a cruel way, it may not be something good for them. So be gentle and kind to them. The other thing you could do is audio recordings. Encourage them to listen to audio recordings of your lesson work as much as possible if you have any, or something related to what you are teaching but it is in audio. They could listen to it many times. These children thrive with the drills. Now, the other thing is you track their daily progress the child is making. Track the daily progress the child is making. This will help you realign your teaching strategies. As far as this child's learning is concerned. They may not make very significant or very major progress, but whatever little progress they make, it needs to be appreciated and also tracked. The other thing, you write keywords or phrases before beginning the lesson and the key points on the chalkboard, on the smartboard, so that they can also be able to see it and hear it and know the key things that you intend to talk about. Make them sit close to the teacher so as to hear and to see the smartboards where your illustrations are as a teacher. Otherwise, when you keep them very far, some of them have what we call auditory discrimination problems, perceptual problems, visual discrimination problems, and they may not actually benefit from your instructions. So it is important that you keep them very near where you are to even avoid also distractions. Because some of them also have attention deficit disorder. Some of them among the children with the dyslexia, it can also occur with ADHD. And some of them may also not have what we call selective attention. Therefore, any stimuli can distract them. So it is important for the child to be near the teacher. Otherwise, viewers, in case you have a child of that nature, it is important that you seek psychoeducational assessment or evaluation so that suggestions can also be made to the way the child can be helped educationally. Otherwise, thank you very much for listening. Bye.